We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
Well, I also want to start off by thanking Linda and thanking all of the participants for this whole conference, especially those of you from abroad. I think it's really important for us to remind ourselves that this asbestos issue is a global issue. And the reality is, in America, most Americans think that we've dealt with asbestos. The vast majority think that asbestos has been banned. They think that there isn't a problem. And it's really shocking when you hear stories like many of you have experienced, but also I know, for example, the story of Michael Bradley, who when he was a little kid, one of the things he loved to do was to go see his dad on the weekends. His dad worked at a landfill. He would always give him a big hug when he would see him. They'd have all kinds of adventures out on the landfill, riding in the truck and playing. And it turned out that Michael was diagnosed in his teens, in his late teens, with a very rare form of peritoneal mesothelioma. And he actually ended up dying of meso before the age of 30. And this meso could only be caused by exposure to asbestos. His family, and I don't know if Sandra's here today, but his family, she is. Thank you so much for being here, and thank you so much for sharing Michael's story. But when you started researching, you found that the landfill actually was an unauthorized asbestos disposal site. And so the exposure had come when he was a child. And these deadly hugs are not something that most Americans understand, and most Americans don't understand that young people are dying of asbestosis or asbestos-related illnesses. And as the executive director of Environmental Working Group, EWG, we're a nonprofit environmental health group. It's really important for us to make sure that people make this connection between their environment and their health, because protecting the environment is ultimately about protecting your health. And we have just launched a campaign. If you could go to the next slide, I'll see if that works. If you could go to the next slide. Nope. The beginning, please. It's a nice preview, though, of all the things to come. We've launched a new campaign, and one of my asks for you today is to go to asbestosnation.org. This is launched by our sister organization, EWG Action Fund. Please follow us on Twitter at asbestosnation. We here have a clearinghouse of information and a huge public awareness campaign that we are just in the beginning phases of to try to make sure that Americans understand that asbestos is still legal in the United States, it's still lethal, and it's still everywhere. So the health impacts of asbestos have been known and documented for more than 100 years. And the industry has covered up those health effects. Asbestos is substantially banned in 55 countries, but not in the US, where we import about 1,000 tons a year. And EWG Action Fund just launched a report where over the last 10 years, we've imported 8 million pounds of asbestos. The ports of New Orleans and the ports of Corpus Christi are the biggest ports where asbestos is coming into the United States. But as consumers and as everyday Americans, we have no idea where that asbestos is going. We don't know where it's used. We don't know if it's in building supplies. We don't know if it's in our consumer products. We don't know where it's going. On asbestosnation.org, you can see what we call the asbestos timeline, which is actually what the industry knew and when it knew it. I encourage you to learn more. But I'll give you some highlights here. So this is a 1958 memo, and just so you know, as early as 1924, asbestos companies their industrial hygienists were warning them that exposure to asbestos would relate and in fact, cause lung cancer. So here's a 1958 National Gypsum memo. We know that you will never lose sight of the fact that perhaps the greatest hazard in your plant is with men handling asbestos, because just as certain as death and taxes is the fact that if you inhale asbestos dust, you get asbestosis. Here's another key document from the 1960s, and this is from Bendix Corporation, which I think is related now to Halliburton. It may be Honeywell. It's either Honeywell or Halliburton. At the end, I just want to highlight this paragraph. My answer to this asbestos problem is, if you've enjoyed a good life while working with asbestos products, why not die from it? There's got to be some cause. Next slide, please. And here's a document from an actual bankruptcy trust, the Manville Trust. The documents above, however, show corporate knowledge of the dangers associated with exposure to asbestos dating back to 1934. In addition, the plaintiff's bar will probably take the position, not unreasonably, that the documents are evidence of a corporate conspiracy to prevent asbestos workers from learning that their exposure to asbestos could kill them. This is a 1988 memo. So there is no question that asbestos companies knew that the products and the substance that they were exposing their workers to here in the United States and abroad, as we've heard already from Barry's presentation, they knew the impacts and the dangers and the exposures to the product. And in fact, you see, internally they're saying, you know what, this looks like a conspiracy to us because it was. And this is one of the things that we're going to be putting a lot of effort in to make sure that Americans not only understand that there's still a clear threat to asbestos today, but the history of how we got here, what the industry knew and when they knew it. Next slide, please. So the top 5 occupations for asbestos disease-related deaths, and we are working on updating this data, is people just working at home, non-paid worker at home, stay-at-home mom is what that translates to. Construction, elementary and secondary school teachers, just exposed by going to work. Now, we know there's a lot of dangers for public educators today. We all understand that, but very rarely do teachers think that asbestos exposure will be one of them. Hospital workers and also people working in older government buildings. Next slide, please. So let's just step back and talk about asbestos regulation in the United States. So asbestos is considered a hazardous air pollutant under the Clean Air Act, and EPA regulates the disposal and use of asbestos. Clearly they don't do it very well because every day there's some article coming out about illegal dumping of asbestos in different landfills, of any of you who are following this. OSHA also has workplace limits for asbestos. And in 1989, the first Bush administration's EPA, that's George H. Bush, they tried to issue a rule called the Asbestos Ban and Phase Out Rule to ban asbestos and prohibit the importing of asbestos. Next slide, please. This resulted in what has now become a pretty infamous case, the Corrosion-Proof Fittings case in 1991, when the Fifth Circuit actually declared that the underlying law, which is what we're going to be really talking about today, the Toxic Substances Control Act of 1976, that the safety standard, which is an unreasonable risk of significant injury to health or the environment, required a cost-benefit analysis. And because the standard was so weak, in the view of someone who is concerned about public health and the environment, was so weak it could not actually ban asbestos. Next slide, please. And this 1991 court case showed what many of us already knew in the environmental health space, and that our Toxic Substances Control Act was fundamentally broken. This law, as I said, was passed in 1976. It governs all chemicals in commerce. When it was passed in 1976, the 62,000 chemicals in commerce were just presumed safe. The safety standard, as I said before, is an unreasonable harm of risk of injury to health or the environment, and the burden is on groups like EWG, normal everyday Americans, university scientists and academics to show that a chemical on the market is unsafe before it comes off the market. So the burden of proof is on us. There, fortunately, are efforts to reform this underlying law. Next slide. Next slide, please. This is hope. So here you see Linda and Emily. And they're there with Senator Barbara Boxer, who has introduced a bill along with Senator Markey of Massachusetts called the Alan Reinstein and Trevor Schaefer Toxic Chemical Prevention Act. And this bill is hope for positive reform of this broken law, which was so weak it couldn't ban asbestos. Next slide, please. its safety standard is a reasonable certainty of no harm standard. This comes from the 1996 Food Quality Protection Act. It governs pesticide exposure in food. It basically means that the burden is now on the chemical companies to show that their products are safe and safe for vulnerable populations. It also has expedited action and review for asbestos. The EPA is required to not only finish its study of asbestos, but take action within 3 years. And it protects states' abilities to regulate and protect consumers from toxic chemicals. Next slide, please. And the next slide. There's also another bill, and this is the bad news. This is the Vitter-Udall bill. Here's my second ask. My second ask is that you call your member of Congress, specifically the Senate, and ask them to oppose S-697 because this proposal is actually worse than current law, the Vitter-Udall bill. The unfortunate news is that there are 10 Democrats that are on this bill. It's a bipartisan bill. There is a lot of momentum for it. It sounds really good. I think all of us really want to see reform of this law, but the problem is the details. And when you stop and when you dive in and you see what's there, it is clearly a bill that has been written by industry. First of all, it has a weak safety standard. At least 34 law professors have written to the Senate Environment and Public Works Committee and said that this safety standard in this particular proposal is worse or weaker than the one I just told you about in the 1976 law. It also has no expedited review of asbestos. There's no expedited review of chemicals that are called persistent bioaccumulative toxins, PBTs. These are the type of chemicals that build up in our bodies over time and never, ever break down. It only requires $18 million in industry fees for chemical reviews. It costs about $2 to $3 million to review each chemical. So that means that EPA will have the funds for about 6 chemicals a year to review. It also, and this is very troubling, preempts states' abilities to regulate chemicals. And this begins even when EPA decides it's going to study something, then the state can't act at all. Just the mere studying of a chemical means that state attorney generals cannot protect their citizens from toxic chemical exposure. And then finally, it can take up to 7 years to only review 25 chemicals. So please, please, please oppose this bill. Next slide, please. Other asbestos-related legislation that we're seeing on Capitol Hill right now, the first is the Further Asbestos Claims Transparency Act, the so-called FACT Act. I think Linda probably talked to you about this morning. This is basically a complete sham bill. The only purpose of this bill, it's not transparency. The purpose of this bill is to prevent victims from getting the compensation that they deserve from bankruptcy trusts. What it requires is detailed personal information in a public database where I think everybody knows here that if you're harmed by multiple people, you have a right to get compensation from all those people who harmed you. And this is the same when it comes to a bankruptcy trust. You can go to each of the companies who is responsible for your exposure or your family member's exposure. And what they want to do is basically by saying that this idea that you're going to multiple people is double dipping, which of course is patently false and untrue and contrary to the canons of tort law. But this is a very, very disturbing bill. So my third ask is for you to call your members of Congress and make sure that they oppose the Farenthold House H.R. 526 and the Senate bill, which is sponsored by Jeff Flake, 357. The next bill, and this is the good news category, is the Reducing Exposure Asbestos Transparency Act, the READ Act, which is sponsored by Senator Dick Durbin of Illinois. And this is actually transparency. What Senator Durbin is asking any manufacturer who uses asbestos or imports asbestos to put that in a consumer database that's publicly available so consumers have a right to know where they are being exposed to asbestos in the products they buy, in their homes, in public places, as well as in the shipyards where they may have loved ones who work. And finally, thank you, Linda, for your great advocacy with Senator Markey for the National Asbestos Disease Awareness Week resolution, which has been introduced, and that's really great hope. Next slide, please. So, in conclusion, I want you to think about everything that you've learned in the last kind of 24 hours. And as powerful as the story is about asbestos, one of the things I hope that we can understand is that it's a cautionary tale for other chemicals that our families and loved ones are exposed to throughout the world. On this top slide, you will see a picture of asbestos fibers, and on the bottom slide are multi-walled carbon nanotubes. And more scientists are starting to believe that nanotubes can have a similar impact as asbestos fibers. We now know that nanotech, these type of particles, are used in everything from bumpers to powdered donuts to the lipstick that you wear or foundation that you use. So it's very important that these lessons of what industry knew, when they knew it, how they're treating the people who are being harmed, and this absolute conspiracy and completely funded effort to prevent the truth from coming out, we need to understand that that's happening across different categories of exposures that we have every day. So thank you all for sharing your stories and for being here, and thank you, Linda, for your tremendous advocacy. We really appreciate it.